A PowerPoint presentation title slide shows a logo for Holland Bloorview Kids Rehabilitation Hospital in the top left corner of the slide on a white background. The text below is white and on a green background. The title of the presentation is Engagement in Therapy, Conversations about Clinical Practice and Client and Family Experiences. Below the title are the names of the presenters: Sarah Keenan, Sarah with an H, K-E-E-N-A-N, Gillian King, Gillian with a G, Jan Magee, M-A-G-E-E, Eric Smart, Eric with a C, and Andrea DeFinney, D-E-F-I-N-N-E-Y, and the date of the presentation, January 19th, 2017.
Today we're hoping to start a conversation with you guys about engagement, what it means in clinical practice, and also about a program of clinical research that we and many others are engaged in. So we are representing a much larger group. There are many people all over the world looking at this. It's a group of researchers, clinicians, students, youth, families, everybody, looking at engagement, what it is, why it matters for outcomes, and how to measure it. So today is really more of a conversation than a presentation, and we're hoping to accomplish these two things. We want to share with you an overview of this program of research. We also want to get feedback from you. We want to hear from you how this might be resonating with you. Is it making sense to you? What difference does it make to you to think about engagement? And as clinicians, managers, families, researchers, what else can and should we be thinking about in terms of engagement? What else should we be considering as we move forward with the program of research? So what is engagement? So we've defined it as the client's commitment or investment in the treatment process, and it has three aspects to it. Affective engagement is how a client feels about the intervention and the therapist. So are they hopeful about the intervention? Are they hopeful about the therapist's ability to help them? Cognitive engagement has to do with what the client thinks about the intervention itself. So does the client believe that the intervention will work? And does the intervention and the plan, do they make sense to the client? And then finally, behavioral engagement is the extent to which the client is participating in activities related to the intervention, as well as their confidence that they'll be able to do the things that they need to do to achieve their goals. And that's in the sessions and also outside of the sessions. So engagement is thought to be important for client outcomes, and service providers can do things that either enhance or inadvertently undermine a client's engagement. So as part of understanding engagement, we want to be able to measure it. We're developing a range of tools to measure engagement from different perspectives. And PRIME stands for Pediatric Rehabilitation Intervention Measure of Engagement. I did have to peek. The self-report measures look at how parents, so in the case of the PRIME P, or children and youth, in the case of the PRIME C, perceive their own engagement in a therapy session. The PRIME G measures perception of engagement across sessions. And then we also are developing tools to measure engagement from the perspective of other people. So the PRIME SP is the service provider's perception of a client's engagement in therapy. And the PRIME PC is the parent's perception of their child's engagement in therapy. And the PRIME O is an observational measure that's designed for use by researchers. So now I'd like to invite Gillian King to talk about this international program of research.
Okay, internationally, you get slides of the world. This program of research, as Tom has said, is funded by CIHR and involves Holland Bloorview. We're the lead site here, as well as investigators in 5 locations around the world. In Toronto, one of our team members is now at St. Mike's. The team is also made up of investigators from Philadelphia, so the university, Temple University and Drexel University there, Oakland University, which is in Michigan, and the University of Queensland in Brisbane, Australia. So we are an international bunch. In addition to the locations I just mentioned where the investigators are, we're collecting data at other sites as well. And our partners include the Rehabilitation Institute of Chicago, who are collecting engagement data with us around the Lokomat intervention. So it's a gross motor intervention. And we're also collaborating with outpatient and early intervention sites in New Jersey and in Philadelphia. Students are also involved with the program of research. They're doing looking at engagement in different ways. They're looking at it for parents and for kids and youth in different intervention contexts with different questions in mind. And 4 PhD students are investigating engagement at this point in time. Eric Smart's presently working on his PhD, and he'll tell you later on about his master's work that had to do with engagement. In addition to the core work that we're doing, the joint work that we're doing together, each site is taking the lead on various aspects of engagement. And in Toronto, our focus has really been on youth life skills, youth engagement and life skills, and also on engagement and solution-focused coaching, and with the leadership of Sarah Keenan and Heidi Schwellness. In Philadelphia, they've been more focused on family engagement in early intervention. And our colleagues in Australia are doing some very unique work. They're pursuing a stream of research that looks at how engagement is driven by people's needs according to self-determination theory. So people's needs for relatedness or belonging, for competence and autonomy.
Great, so now I'm going to invite Jan Magee to come up, our family leader, and she's going to talk about the interprofessional collaborative aspects of this program.
Thank you, and hello everyone. I've been a family leader at Holland Bloorview for a little over 7 years, and I'm also currently the vice chair of the Research Family Engagement Committee. And I'm very honored to be a part of this project, and I have a great interest in engagement for 2 reasons. One, my 17-year-old son, who has cerebral palsy, he's been a client of Holland Bloorview since he was 18 months old, so that's 15 and a half years that have flown by. And having him engaged in his therapy treatments is extremely important. Not only is it obvious to me that he tries harder and he has better success when he's engaged, I also feel that it's an important component for him to be self-motivated as he approaches adulthood, because this way he will continue to look after his overall health and just manage his condition, as well as, be motivated to be more independent. And I've also noticed that kids watch their parents even when they don't think they're paying attention. So when they see us as engaged parents, that reinforces a role model that they need to adapt for themselves. Therefore, engagement to me involves both the parent and the child, and this project addresses both of those aspects. Secondly, he's been involved as a participant in research projects at the Holland Bloorview Research Institute since he was 2 years old, and I believe that research is so important to ensure that the progress can be made with new discoveries and treatments that will help, current and future families and clients. This practice-based research project is very important to me because of the collaborative, integrated approach with all the stakeholders involved. So the team of researchers, students, physiotherapists, and occupational therapists, psychologists, knowledge users, and clinicians are involved in the ongoing process to ensure the result will have an impact on engagement and the success of rehabilitation related interventions. So included in this integrated approach, of course, is the input from the parent perspective and former clients and youth leaders, which enhance the project and helps to make a difference. I've been involved in the project by attending the monthly team meetings and giving input from the parent perspective by either giving, additional parent input or sometimes perhaps questioning a concept or idea to give the team members a different viewpoint. And I've also been involved in the simulation training for engagement on advising the parent role when attending a therapy session for their child or youth. So we're really looking forward today to having a conversation with you around what engagement means to you and why it's important from the different perspectives in the room. So I will now turn it over to Andrea.
I'm Andrea DeFinney. I'm a therapeutic recreation specialist here at Holland Bloorview, and I'm also a member of the same research projects that we've been discussing. My role in those projects is as a knowledge user, which means that as a clinician, I'm someone who will eventually be able to benefit from the knowledge and the resources that are generated as a result of the research. So for me, it's really exciting because I know that that engagement is so important to the clients that I work with. So it's been really exciting to be a part of contributing my perspective as a clinician, bringing that point of view. As Jan said, she brings sort of the parent's point of view, and we have lots of different members of the team. But I'm there to share from a clinician's point of view any thoughts and ideas, and it's really exciting to be able to contribute to some work that will ultimately be able to be a tool that I can use as a clinician in the future to do a better job of serving my clients and families that I work. So we're going to move on to the interactive part of the session. You guys might notice you're sitting at round tables, which is a bit of a different format than usual knowledge connections. What we want to do now, the rest of the team has given you a bit of background, and what we want to do now is hear a little bit from you. So we really would like you to think about the two questions up on the screen here. So in what ways does engagement matter to your practice as a clinician? Or in what ways does engagement matter to your experience as a client or family? And if you don't fall into one of those two categories, why do you think engagement matters to us here at Holland Bloorview?
PowerPoint slides are used in this video to summarize the discussion that happened at the roundtables during this workshop. The first slide says at the top, to clinicians, client engagement was viewed as, followed by 3 dots, also known as an ellipses. The slide is on a white background, and this text is in green with the word clinicians bolded and underlined. Underneath are 3 statements that are in blue and black and white icons. The first 2 statements on the bottom left half of the slide say, promoting commitment to goals, contributing to meaningful client and family goals. The words promoting and contributing are bolded. There is an icon of a soccer ball in front of a soccer net above the 2 statements, and there are 3 angled lines to our bottom left of the soccer ball to indicate motion. The icon is credited as created by Adrian Coquette, ADRIENCOQUET, from Noun Project. To our right, the third statement says, providing clinicians with a better understanding of the client's world. The words providing clinicians are bolded. There is an icon of a globe above the statement, and the icon is credited as created by YO, the word Y-O with an exclamation mark, BABA, B-A-B-A, from Noun Project. At the bottom of the discussion summary slides is the No Boundaries Strategic Plan logo with waves of orange, blues, and greens. The words No Boundaries are at the bottom left of the slide in white on top of the waves. At the bottom right of the slide, on top of the waves, is the Bloorview Research Institute logo in white. The second slide says at the top, to clinicians, client engagement was viewed as enhancing, followed by an ellipses. The word enhancing is in all caps and bolded. The slide is on a white background, and this text is in green with the word clinicians bolded and underlined. Underneath are words that are in blue and a black and white icon. The words are 2 to a side of an icon of a magic wand that is credited as created by Ben Davis from Noun Project. The words on the left are motivation and likelihood of good outcomes, and the words on the right are family satisfaction and carryover after session. The third slide says at the top, to clinicians, client engagement was viewed as helping, followed by an ellipses. The word helping is all caps and bolded. The slide is on a white background, and this text is in green with the word clinicians bolded and underlined. There is an icon to our right of a hand that's filled in with black and another small hand filled in with white laid on top of the bigger hand's palm, facing downwards between the bigger hand's thumb and index finger. The icon is credited as created by Gilbert Bages, Bages, from Noun Project. Underneath this statement and icon are 3 statements that are in blue and black and white icons. The first statement says, clients feel, which is bolded, italicized, and in caps, and followed by an ellipses. And then underneath, on top of each other, are the words ownership, empowerment, control, that are italicized. To our left of the word ownership is an icon of a person from the waist up with a light bulb in the center of the torso. The icon is uncredited. To our left of the word empowerment is a closed fist in the gesture of power. The icon is credited as created by Alexander James Wright, Wright with a W, from Noun Project. To our left of the word control is the symbol for play pause. The icon is credited as created by Sylvain Amatoury, Sylvain Amatoury, from Noun Project. The second statement to the right of the first and underneath the hand icon says, make appointments more smooth and quick and more enjoyable and less effortful for clinicians. The words make appointments are bolded and the word and is in caps. To our left of the statement is an icon of a schedule page that is credited as created by Rafleur, RFLOR, from Noun Project. The third statement below the second statement says, reduce misunderstandings and dependency on healthcare teams. The word reduce is bolded. To our left of the statement is an icon of 2 arrows facing each other on an angle. The icon is credited as created by ProSymbols, one word with a capital P and a capital S, from Noun Project. The fourth slide says at the top, to clients/families, client engagement mattered because, followed by an ellipses. The slide is on a white background, and this text is in green with the words client/families bolded and underlined. There are also black and white icons. Underneath client/families, the words it helped are all caps, italicized, bolded, and in blue, and followed by an ellipses. Underneath it says families feel cared about, children enjoy therapy sessions, with motivation, in blue and italicized. To our left of the words families feel cared about is an icon of a hand, and it is cupping or holding the icon of a person that is a head and a curved shape for the torso. The icon is credited as created by Creative Stall, 2 words, from Noun Project. To our left of the words children enjoy therapy sessions is an icon of a balloon credited as created by Yasmin Alanis, YAZMINALANIS, from the Noun Project. To our left of the words with motivation is an icon of a megaphone credited as created by Gregor Kresnar, GREGORCRESNAR, from Noun Project. To the right of these statements are 2 more statements in blue. The one on top says, it meant meeting the family where they are and their needs. The words it meant meeting are in caps and bolded. Above the statement is an icon with 3 person icons sitting around a table. The icon is credited as created by Creative Mania, 2 words, from Noun Project. Below is the second statement that says, it showed an investment in the whole process. The words it showed are in caps and bolded. To our left of the statement is an icon of a person with a bent arm outstretched. Above the forearm is an icon of a clock. The icon is credited as created by Aneek Ahmed, ANEEQUEAHMED, from Noun Project.
I would like to invite Eric to come on up, and he's going to be sharing an example of a project looking at engagement in youth life skills programs. So Eric, come on up.
Thank you, Sarah. So I'm going to talk briefly about a study completed with Gillian King as part of my time in the occupational therapy program at the University of Toronto. The aim of this study was to learn from youth in life skills and transition programs about what strategies optimize their engagement towards goals. As Sarah introduced earlier, understanding engagement in terms of the affective, cognitive, and behavioral components was very helpful for us in structuring our interviews with youth. On the slide, there are 2 sample quotes. For the affective engagement, the slide reads, "I remember the service provider has known me from before, from another program, and she knows how I work and what things I like to do and what I want to be in the future." We interpret this to mean that youth in this study became more engaged when they perceived their service provider to be proficient not only in technical therapeutic skills, but also in core interpersonal skills related to understanding youth as being on a long-term journey. Engaging service providers saw youth relative to big picture goals. Next, for behavioral engagement, the quote reads, "I feel like I can reach a goal because I have the resources, I got a lot of mentoring, I have everything in place, I just need to put it together and kind of pursue it." Here we interpreted youth to become more engaged when they could visualize a clear path towards achieving their goals. A path made possible by co-creating with their service provider a network of resources they could draw upon and use on their own terms. Overall, while conducting this study, we found that a greater number of opportunities to engage youth could be identified when we truly learned and understood what engagement means. And if you would like to learn more about this subject, the references below, or I would be most happy to talk with you afterwards.
Okay, so time for another question. One of the aims of this program of research is to develop tools to measure engagement. So Sarah showed you a slide earlier with the various versions of different tools that are being developed. So a part of that is that we need to examine what engagement actually looks like. So our next questions for you are to talk about how do you know that your clients are engaged, and or what do you look like when you are engaged? So I know those both kind of sound like a simple question, but we want you to kind of really dig deep and to think about all of the things that we might be seeing or experiencing to show us that you yourself or the person that you're working with is engaged.
PowerPoint slides are used in this video to summarize the discussion that happened at the roundtables during this workshop. The first slide says at the top, "To clinicians, clients are engaged when they come to appointments," followed by an ellipses. The words "they come" are underlined and italicized. The slide is on a white background, and this text is in green with the word clinicians bolded and underlined. Underneath is an icon of a person, a female, pushing a wheelchair, and there is a person using the wheelchair. The person icons are filled in with black and are on an orange square background. The icon is credited as created by Fabio Moroni, M-E-R-O-N-I, from Noun Project. The orange square the icon is on is encircled by 5 circles, each containing words. Their circles are filled in blue and have white text and are connected with a green ring. The blue circles say from the top, going clockwise, with questions and comments, regularly, punctually, eager, and excited. At the bottom of the discussion summary slides is the No Boundaries Strategic Plan logo with waves of orange, blues, and greens. The words No Boundaries are at the bottom left of the slide in white on top of the waves. At the bottom right of the slide, on top of the waves, is the Bloorview Research Institute logo in white. The second slide says at the top, "To clinicians, clients are engaged when during appointments they," followed by an ellipses. The word during is underlined and italicized. The slide is on a white background and this text is in green with the word clinicians bolded and underlined. Underneath is an icon of a person as a side profile facing our left. The person is slightly bent over with their left arm holding the icon of a single rehabilitation parallel bar. The person icon and the bar icon are filled in with black and are on an orange square background. The icon is credited as created by Gan Khoon Lay, G-A-N-K-H-O-O-N-L-A-Y, from Noun Project. The orange square that the icon is on is encircled by 7 circles, each containing words. The circles are filled in blue and have white text and are connected with a green ring. Starting from the top and going clockwise, the blue circles say, "Are motivated and show effort, contribute to the therapy process, contribute to goal achievement, have a clear vision of therapy goals, ask questions, participate, help troubleshoot around issues. The third slide says at the top, to clinicians, clients are engaged when outside appointments. They, followed by an ellipses. The word outside is underlined and italicized. The slide is on a white background, and this text is in green with the word clinicians bolded and underlined. Underneath is an icon of a house and a tree that's to our right of the house. The house and tree icons are filled in with black and are on an orange square background. The icon is credited as created by Creative Stall, 2 words from Noun Project. The orange square that the icon is on is encircled by 3 circles, each containing words. The circles are filled in blue and have white text and are connected with a green ring. Going clockwise, starting from the top, the blue circles say, follow through with recommendations, are on board with the treatment plan, return phone calls.
So now Gillian's going to talk about what we're actually finding in the research about what engagement looks like.
I was really struck by all of your comments because it just resonated so much with the kinds of things that we've been hearing from other service providers. So we've done a lot of interviews. We did 30 qualitative interviews with different groups, parents and service providers and youth themselves, as well as observations and sessions and interviews and so on and on and on. So part of the research we were looking at, were there different signs of engagement for children and youth? So we were trying to see were there similarities and differences depending on who they were, the age, right? So the quote on the left is the provider's view of child engagement, very similar to what you were saying there in the back. The quote reads, they're having fun, they're looking at you, if you're making a joke, they're laughing at you, but they're paying attention and they're also trying hard. So from this we inferred the importance of that personal connection between the provider and the child, that importance, the fundamental importance of that affective involvement, also called the Therapeutic alliance. So that affect has to be there. That relates a lot to what you were talking about in terms of the optimism and that positive energy and all of that. That's the strong affective piece. But there's more to engagement than that. You were talking about behavioral aspects, but we also have the provider view of youth engagement. This quote illustrates cognitive engagement. It reads, when you get older, it has to be that they're involved. When I have the conversation with them and they see the value and understand that I'm expecting more from them, then I get nice involvement in changes, which is what we're looking for. So here we see the growing importance of cognitive involvement as children get older, become youth. This is very important for parents as well. The importance of youth and parents seeing the value in the intervention and understanding what it's all about, and we tend to really downplay that from the cognitive side of things.
So for one final opportunity for discussion, we would love to hear from you if there are any other thoughts that you would like to share, feedback or ideas around what else the research team should be thinking about as we move forward, or any other thoughts or questions that you have.
PowerPoint slides are used in this video to summarize the discussion that happened at the roundtables during this workshop. The slide says, things to think about at the top, followed by an ellipses. The slide is on a white background and this text is in green. Underneath are 2 columns side by side. The first column is titled Research Ideas. The title is in white on a blue background. Underneath are 3 statements listed one on top of the other in blue, each with a black and white icon. The first statement, factors that influence client engagement, has an icon to our left of it, which is of a set of 2 keys that is credited as created by Eliricon, Eliricon, from Noun Project. The second statement, learned from others outside healthcare, has a magnifying glass icon to our left of it that is credited as created by Nick Abrams, Nick with a K, Abrams from Noun Project. The third statement, consider cultural perspectives, has an eye icon to our left of it that is credited as created by Emilia Graphics, Emilegraphics, one word, all small letters, from Noun Project. The pupil of the eye has a rising sun in the background, and rays of light are coming from it towards the front of the icon to represent perspective. The second column is titled Organizational Ideas. The title is in white on a blue background. Underneath are 3 statements listed one on top of the other in blue, each with a black and white icon. The first statement, address system barriers, has an icon of a traffic cone, also known as a pylon, to our left of it. The icon is credited as created by Hopkins, Hopkins, from Noun Project. The second statement, provide education, has an icon of a graduation cap to our left of it that is credited as created by Jivan, Jivan, from Noun Project. The third statement, consider strategies and resources to improve engagement, has a speech bubble icon to our left of it that is credited as created by Roy Verhaag, Royverhaag, from the Noun Project. At the bottom of the discussion summary slides is the No Boundaries strategic plan logo with waves of orange, blues, and greens. The words No Boundaries are at the bottom left of the slide in white on top of the waves. At the bottom right of the slide on top of the waves is the Bloorview Research Institute logo in white. We've shared an overview of our international team of clinicians, researchers, and families' ongoing work on engagement. In order to understand this important and previously ill-defined construct, we have developed tools to measure engagement from different perspectives. We believe that by better understanding and measuring it, we can enhance engagement and improve clinical outcomes for clients and families. The video ends with 2 slides titled Find Out More, followed by an ellipses, all in green. The slides are on a white background and have the Prime logo in the right top corner. The first slide reads, to learn about this research team and their research, and to access the Prime O or Prime SP, followed by a colon. This is in blue with the words Prime O and Prime SP bolded. The text is followed by a website in green and bolded. http://primeresearchteam.com. The second slide has contact information for 4 of the 5 presenters. The contact information is in blue and the names of the presenters are bolded. Sarah Keenan, knowledge user, SKEENAN @hollandbloorview.ca. Gillian King, lead investigator, gking@hollandbloorview.ca. Andrea DeFinney, knowledge user, ADEFINNEY @hollandbloorview.ca. Eric Smart, research trainee, capital ESMART @hollandbloorview.ca.